Hey everyone, I'm going to talk about the ITP. Right, um, so what is ITP? It is an autoimmune thrombocytopenic purpura. So here's a case scenario. A 5-year-old child has a story of bruising on his face, neck, and lower limbs for 3 to 4 days with bleeding gums and mild epistaxis. By the way, I'm sorry for my voice, I've gossiped a lot, or maybe she has just recovered from a viral infection, chickenpox. On examination, there are multiple petechiae and purpura on her extremities, and spleen is not palpable. Her mother denied giving her any aspirin or any platelet medication. With that being said, let's go to the CBC. Okay, here's the CBC. It's going to be hemoglobin normal. The RBC's mild anemia. The BLBC's normal. Here we have leukocytopenia, lymphocytosis, because it is sort of viral infection. Thrombocytopenia, unfortunately, because of those antibodies. Here's a blood film that shows thrombocytopenia, lymphocytosis, and mild anemia. Just let's begin here. So interpret the previous CBC. Here we have thrombocytopenia, right? Because of those antibodies, right? So because of the antibodies, that's why do we have thrombocytopenia, mild anemia due to bleeding. Yep, because of thrombocytopenia. That's why. Something makes sense. Relative lymphocytosis due to viral infection. So basically, let me just explain something out here. For every single disease in this world, and it is an autoimmune disease, it doesn't occur until there's an infection before it, fortunately, for glomerulonephritis, for ITP, for arthritis, etc. Like everything that is an autoimmune disease has a prior infection. And in this case, the patient has a history or had a history of viral infection. That's why. So here we have lymphocytosis due to viral infection, mild anemia due to bleeding, and we have thrombocytopenia because of those antibodies. Okay, so in the CBC, we're gonna find thrombocytopenia, mild anemia because of the thrombocytopenia, and relative lymphocytosis, right? Because of the viral infection. So that is a normal, or the investigation, or the CBC that you're gonna find in a patient of the ITP, right? Right. So just erase these. Just to recap. Anemia, because we've low platelets, right? And once we have low platelets, we're gonna lose blood. And once we lose the blood, we have anemia, but it's going to be mild, right? So where does it come? So this is the mild anemia. A lot of lymphocytes because of the viral infection, right? So these are the three most important investigation on the CBC that you're gonna find: anemia, and thrombocytopenia, and maybe lymphocytosis. Those indicates a case of ITP. Alright, that makes sense. What is the professional diagnosis? It's going to be immune thrombocytopenia, ITP, right? There are a lot of antibodies that attack the platelets. Poor platelets. What is the needed investigation to confirm the diagnosis? The first thing, we're gonna do the bleeding time and a platelet function test for platelet disorders, right? What is going on? We wanted to know what is going on in those platelets. Why do they have some sort of continue? Okay, thrombocytopenia, platelets that are initial diagnosis. Why do we apply the bleeding time and the platelet function test? Okay, because we want to know what is going on. What are the problem of those platelets? So that's why did we apply the bleeding time and platelet function test, right? The second thing going to be PT and PTT for coagulation disorders. We don't know the exact of the cause of it. We don't know what is the cause. So we're gonna do all the tests that we can. We're gonna do a lot of things, and one of them is going to be PT and BTT for coagulation disorders. That is specific for coagulation factors. Okay, the dimer for DIC. Okay, renal function test for hemolytic uremic syndrome. Sometimes like those platelets are getting stuck on the glomerulus. Okay, so that's we don't have platelets. They are all stuck in the glomerulus, so that's maybe a cause as well. So we want to investigate for the renal function test. Anti-platelet antibodies for immune thrombocytopenic purpura, which is our concern and our disease, right? Bone marrow aspiration, biopsy for confirmation and acute leukemia. We don't know that leukemias, okay, I'm sorry, like leukemias are just diagnosed by the bone marrow biopsy, right? So that's why, like, but it's going to be the last thing that we're gonna done. Okay, so the first thing, bleeding time, PT and BTT, the dimer, renal function, anti-platelet antibodies, bone marrow aspiration for leukemia. We're excluding the leukemias. Okay, what are the expected findings in the required lab investigations? They're gonna be bleeding time prolonged. Okay, there's like, okay, you're gonna wonder why there's an abnormal function. Okay, because those platelets are getting decreased, right? They are decreased, and then they're not gonna do their job as well. They're gonna some defect on they're doing on their jobs, right? That means once they are decreasing number, they're not gonna do their job effectively. So that's why it is prolonged. Blood function test is going to be normal, but this is the most important one. Coagulation profile is normal, because the problem is not at the coagulation factors. D-dimer normal, creatinine and the kidney is normal. Anti-platelet antibodies, they're going to be positive for IgG antibodies, right? And IgG, okay, is so specific for ITP or the platelets. So those and IgG going to attack the platelets. Alright, okay. Bone marrow aspiration biopsy, normal myeloid, lymphoid, erythrocyte series. Okay, like even though we have a decrease on the RBCs, right? Because of the bleeding, and we have a decrease on the WBCs, right? But that not because of the bone marrow problem. It's because we have bleeding, we have like a peripheral issues not related to the bone marrow. Okay, so normal myeloid, lymphoid, and erythrocyte series, increasing number of megakaryocyte and immature megakaryocytes. Okay. Why do we have increased number of megakaryocytes in the bone marrow? Well, because of we have a decrease on the platelet number on the peripheral blood. So that's why we have bone marrow produces so many megakaryocytes to compensate the decrease on the platelets. So to recap, what are the some findings that we're gonna find on those investigations? Bleeding time going to be prolonged, which is positive. The coagulation normal, dimer normal, creatinine normal, anti-platelet antibodies positive, and bone marrow aspiration biopsy all gonna be normal except the megakaryocyte, which is the source of the platelets. Okay, what is the expected clinical data correlated to this condition? history of viral infection prior to this case. Okay, this is number one. So most of the cases that comes to you in your clinic, going to be all prior to a history of viral infection, maybe so. This is like mostly in 99% of the cases, maybe so. Bleeding gums, epistaxis, and bruising all over the body because of decrease in improved platelets. Okay, here's a good question, right? Once you notice there is a superficial bleeding on gums and superficial surface of the body, that indicates that the problem from the platelets. But once there's a bleeding on the joints, the deep tissues, that indicates that the problem is in the coagulation factors, not in the platelets. So once it is in the platelet, the problem in the platelet, so the problem going to be the bleeding going to be on the surface, and once it is deep side the bleeding, it's going to be from the coagulation factor. Okay, it is like an information fact that you want to know. Multiple petechiae and purpura in the extremities, which is superficial. Okay, so some of the clinical data that you're gonna find: history of viral infection prior to this case, bleeding gums, epistaxis, bruising all over the body, multiple petechiae and purpura on the extremities. Okay, so which is the first one is history of infection and bleeding all over the surface of the body. Okay, what is this is like it asks how so the normal value of RBCs, WBCs, and blood is not important. What is the expected diagnosis according to lab and clinical data? So he asked how the diagnosis is going to be acute, immune, thrombocytopenic, purpura, idiopathic. There is a fact here. Once you see an idiopathic, it means the cause of antibodies, right? So I for immune, thrombocytopenic for T, and P purpura. So ITP stands for immune thrombocytopenic purpura. And that's it. With that being said, thank you so much.